Hello and welcome to tonight's presentation, Administration of Medication in Pennsylvania Schools, Review of Clinical Practice Guidelines for Safe, Legal, and Appropriate Student Care. My name is Jacquelyn Raco. I am a practicing nurse for the last 32 years, with the last 19 of them being a school nurse. 10 of those years spent in the schools as a school nurse and supervisor, and 8 at a local university as the director of school health programs and a professor within the program. And currently, I am now working for the National Association of School Nurses as a nursing education and practice specialist. I want to introduce you also to our second presenter this evening, Rebecca Reape.
Hello, I'm Rebecca Reape, and I've had the privilege of serving as both a school nurse and nurse coordinator in Montgomery County public and parochial K through 12 schools since 2005. In addition to my work in the schools, I've taught as an adjunct professor in Pennsylvania, focusing on legal issues and special education within the Certified School Nurse Program. I also currently serve as one of the Southeastern Region representatives for PASNAP, and it is an honor to continue contributing to the growth and strength of our unique profession.
So great to have Rebecca here tonight with us. So we're going to get started so you can learn all about medication administration in the schools. This is just our disclaimer. We have no financial relationships to disclose, and this is for education purposes only. This is the purpose of our presentation tonight. And these are the objectives. And just so you're aware that you will be receiving after the presentation, PDF version of the slide so that you can take the time to review all of this information. So we're going to get started and we'll talk about what this presentation is based on. And the first things we want to talk about are the guiding documents. The first guiding document that we have is from the NASN, or the National Association of School Nurses. In 2021, NASN commissioned a uniformed evidence-based clinical practice guideline, which is known as a CPG, for the administration of medications in the school setting. The purpose of the CPG is to give professional nurses evidence-based recommendations for safe care of students grades PK through 12. The CPG is broken down into 11 domains, and those appear on the slide in those boxes. To help implement the guidelines in your schools, there is an accompanying toolkit that NASN has put out. All types of sample policies, protocols, checklists, guidelines are all listed in this toolkit. And both of these are listed in the reference for easy access, and both are free to NASN and non-NASN members. The second guiding document comes from the Pennsylvania Department of Health. And this is their document on the guidelines for administration of medications and emergencies. This was published in 2010. It has not been updated since that time. And these guidelines have been written to assist schools in the development and implementation of appropriate medication administration policies and procedures. And our final document comes from the Department of Education, and that is the Department of Education Certification and Staffing Policy Guidelines, or CSPGs. These conform to state law. So you'll see on the screen CSPG 101. It speaks to the paraprofessional and the non-professional school staff, and CSPG 95 refers to the school principal's role. The primary reasons that these CSPGs are in effect is that administering medications requires the judgment and assessment skills of a licensed nurse. And it's very important for you to be aware of what you can do under state law and state acts and how that affects your nursing license and also your school nurse certification. So we're going to move on to medications in schools and statistics. This is taken from the 2025 NASN Impact on Learning Student Report. The statistics show here the importance of understanding medication safety and practices as school nurses. Nationally, there are almost 50 million youths in schools. Students receive medication in schools for chronic and acute conditions that impact their health, their safety, and their learning. And this is information that was retrieved with permission from Colleen Schultz, who is the Director of Health, the Director of School Health Programs at the Department of Health. Colleen shared with us the information from the SHARS report from the data from 22-23, which is the most recent data on hand. I think it's important to realize that in Pennsylvania that year, 344 million total number of medications were administered in Pennsylvania schools. And there were over 1 million total doses written by standing order or individual order. Analgesics, anti-inflammatories, diabetic medication, and ADD, ADHD medications were the most frequent types of medications given in Pennsylvania schools. Antibiotics, asthma medication, and GI medications followed. So as you can see, the role of the school nurse and medication administration is one that is heavy that they have to do every day, and knowing how to do it correctly is extremely important. So this brings us to how we practice, and that's based on the NASN School Nursing Practice Framework and our school nurse standards of practice and performance. Updated in 2024, NASN School Nursing Practice Framework continues to show the student, family, and the community at the center of the model. Supporting them are 4 principles of school nursing: community, care coordination, quality improvement, and leadership. The standards of principle is depicted as the foundational layer, and the school nurse stands upon that foundational layer while overseeing and holding responsibility for the other 4 overlapping principles. If we look at the principle of care coordination and the standard of performance and communication regarding medication, we can apply the concept of confidentiality. As the steward of the medical record and medication documentation, you must be aware of what can be shared, whom it can be shared with, and how it can be shared. Consider this principle not only in medication administration, but medication drop-off procedures to maintain privacy and confidentiality. The principle of quality improvement and the standards of collaboration and education regarding medication can be applied to school health plans. Medication inclusion should be part of the student's health education plan and specified in that plan. Students with emergency medication should have an emergency action plan. Students who receive meds for chronic conditions should have medication in their IHP or individualized health plan. So your students with diabetes or who are taking seizure medications at schools should also have an IHP. However, it is up to the school nurse to create an IHP for a student who does not have a chronic condition but receives medication at school. So if you have a student who takes lactate every day for a lactose intolerance, but it may not warrant them to be in the need of an IHP, it is up to the school nurse's decision. Medication orders should not be attached to plans of care because medication orders change. You just need to indicate in the plan, see most recent medication order. The principle of leadership is what we're going to look at next. Leadership reflects the performance standards of advocacy and leadership by the school nurse. The school nurse should lead the development of district medication administration policies. If there is no policy, the school nurse should alert administration and be a member of the team to determine that school policy. And finally, the principle of community and public health. When we look at this, we are looking at the standards of equitable practice and resource stewardship. The school nurse needs to assess and determine medication resources by engaging community partners. For example, obtaining free EpiPens or providing education to community clinics to all families in a language that they can comprehend. NASN CPG domain breakdown is important, and we're going to look at that on the following slides. As you see there, the 11 domains are in the colored boxes, and on each slide, you will see one of those colored boxes that reflects the information that we are giving to you tonight. You will also see citations from the PA Department of Health so that you know that that information also came from the guidelines that we presented earlier.
Great. So let's take a closer look at key components of a strong school medication administration policy. First, policies must comply with state and federal laws, including updates to the State Nurse Practice Act to ensure safe and legal practices. Second, policies should be consistent across all district schools to promote equity and to avoid confusion. Third, medications should only be administered during the school day when absolutely necessary, minimizing disruption and risk. And fourth, clear procedures must state who can deliver medications to school, typically a parent or guardian, to prevent unauthorized delivery. And finally, all policies should be reviewed by the designated committee every 2 years to stay current with laws and best practices. This slide outlines the essential documentation and communication requirements related to medication administration in schools. School districts must require a licensed prescriber's order for both prescribed and over-the-counter medications. Some districts also use standing orders from a district provider. Authorized prescribers include physicians, podiatrists, dentists, optometrists, CRNPs, and PAs approved by the Department of State. Orders must list the student name, medication details, prescriber and pharmacy contacts, and expiration date, and must be renewed yearly. Any changes must come in writing from the prescriber. Written parental consent is always required. Parents must be informed annually about their rights, responsibilities, and the school's medication emergency procedures. Next slide. This slide highlights that certain medications and health treatments must be handled like prescribed medications, requiring both a licensed prescriber's order and parent or guardian consent. This ensures safe, authorized, and legally compliant medication administration. Schools can meet the prescriber order requirements through a standing order from the school physician or an individualized order from the for the student's healthcare provider. In both cases, the process ensures that medication administration is directed by a licensed professional and is not left to any assumptions or discretion, protecting both students and school staff. Next slide. Thank you. Emergency medication. This slide explains who can administer emergency medications in schools and under what conditions. Trained staff, both licensed and non-licensed, may give certain emergency medications like epinephrine, Narcan, rescue inhalers, and glucon, which is authorized under Act 86 of 2016. These medications can help save lives, must be accessible quickly. However, medications like Diastat and Versed, they're used for seizures and they must be only given by licensed medical professionals due to their need for an assessment, complexity, and risk. Emergency medications must be stored securely but easily and accessible in a crisis. Next slide. This slide covers the limited situations where students may self-carry and self-administer medication at school. Only 4 emergency medications qualify: asthma inhalers, insulin, glucagon, and epinephrine auto-injectors. To self-carry, students must have a licensed provider order, parent permission, and nurse confirmation that they can manage this medication safely. Students must demonstrate they know how and when to use it, how to store it properly, and report its use, keeping themselves, other students, and the school environment safe. If a district does decide to provide emergency oxygen, a standing order from the school physician is required, outlining protocols, route, flow rate, and when to administer. Storage procedures and warning signs, including window signs for first responders in case of a fire, must also be in place. Check your township policies. For students with chronic conditions needing oxygen, an individual order from the provider is required. This slide addresses non-standard, alternative, and experimental medications in schools. Districts can choose whether to allow them with guidance from legal counsel and the school health team. If permitted, they require a licensed prescriber order and parental consent, just like any other medication. Only providers with Department of State approval may prescribe. Off-label use must be backed by solid evidence, and clinical trial medications require access to research protocols. Schools are not required to honor requests for non-standard treatments, supplements, or doses outside manufacturer guidelines. Homeopathic and alternative medications should not be administered due to safety risks. This slide explains the use of verbal medication orders in urgent situations when waiting for a written order could delay care. PAs, CRNPs, RN, and under specific conditions, LPNs may accept verbal orders. A written order should follow within 5 school days. Districts must have clear policies outlining if verbal orders are allowed, who can accept them, the time frame for written confirmation, and how to document this properly. Clear procedures help prevent miscommunication and protect all students and staff. When training school staff to administer medication, it's essential to follow Pennsylvania law, which requires both demonstration and assessment of the trainee's ability to perform the task. Staff must be trained to administer medication safely and correctly, and they must show they can do so independently. Trainees must understand the signs and symptoms of common medical emergencies, such as an allergic reaction and hypoglycemia. They need to know where to locate each student's emergency action plan, follow general standards for safe medication administration, and adhere to student-specific instructions. They also need to know when to contact the school nurse. After completion of training, staff must sign a form confirming successful completion of both the medication administration training and the skill checklist. This process ensures legal compliance and supports the safety and well-being of all students. Next slide. Field trips and medication. This slide covers medication administration during field trips, ensuring students receive the same care as when they're in school. Medications must have a valid order from a licensed PA healthcare provider, Pennsylvania healthcare provider, and written parent permission. Parents cannot alter treatment plans unless they are a licensed prescriber. Schools may request but cannot require a parent to accompany their child for medical care. Under the Pharmacy Act, only licensed pharmacists can dispense medication, so nurses must avoid prepacking or relabeling medications. Medications should remain in their original containers, administered according to school policy and proper delegation. Collaboration between families, nurses, and administrators ensures student safety off campus.
Okay, so we have a knowledge check for you. You'll see the question on the slide. A parent may designate a responsible adult to provide medication or treatment to their child on a field trip if the parent, and you can choose more than one answer here, A, confirms in writing with the school nurse that the school nurse will provide the medication to the responsible adult designee, confirms in writing the school nurse will provide the training to the responsible adult designee, provides the medication to the responsible adult designee, or provides the treatment training to the responsible adult designee. So take a couple seconds and think about that, and then Rebecca will tell you the correct answer.
So based on that question, if a parent or guardian cannot accompany their child, they may designate a responsible adult to do so. If the parent delegates medication or treatment responsibility, they must provide all necessary supplies and training. Per the Pennsylvania Nurse Practice Act, the school nurse may not train any adult, may not supply medication or equipment, and may not participate in the delegation process. Parents may also not delegate these responsibilities to school staff, school designated chaperones, or students. For a Pennsylvania CSN, out-of-state and international field trips require verifying this nurse's license validity and ensuring insurance coverage. For international trips, check with the United States Department of State and the consulate to confirm legal care provision. Remember, self-carry rules on campus apply the same for field trips. Students can self-carry only 4 medications: asthma inhalers, insulin, glucagon, and epinephrine injectors. They need a written order from a healthcare provider, parental permission, and must demonstrate the school nurse that they can manage the medication responsibly. Next slide, please. Here's an important one. EMTs and paramedics who work as school employees or volunteers are not under EMS command. So while they may be great at saving the day in a real emergency, they cannot administer treatments or medications to students during regular school hours unless they're officially on duty as EMS. In other words, just because they can jump into action and save the day doesn't mean they get to play pharmacist in the lunchroom. The school district has to make sure any treatments or medications are administered according to school policies, not just because they know how to start an IV. Next slide. For Pennsylvania's certified school nurse, the same rules apply to out-of-state and international field trips. For out-of-state trips, the CSN must verify if their Pennsylvania license is valid in the visiting state and ensure the district's liability insurance coverage for that trip. For international trips, the CSN must check with the U.S. Department of State and the consulate to confirm that they can legally provide care abroad. Always ensure legal and insurance coverage is in place before traveling. Next slide. Medication delivery. To ensure safety and accountability, medication should be delivered by a responsible adult in the original pharmacy labeled container or manufacturer's packaging. Upon delivery, the amount is counted by both the adult and the certified school nurse or staff nurse for accuracy. Documentation includes date, time, name, the amount of medication, along with signatures of both the adult and the licensed school health professional. Medications in plastic bags or unlabeled containers will not be accepted for safety reasons. Next slide, please. Medication should be stored in their original pharmacy container to ensure proper identification and usage. No more than a 30-day supply should be kept in the school at any time. Effective controls that prevent theft or misuse, including securing access keys or codes. Emergency medications must be stored securely but be easily accessible. Medications requiring refrigeration should be stored in a locked fridge, separate from food. Non-emergency medications should be restricted to the school nurse and stored in locked, secure areas. Proper security, control, and monitoring ensure medications remain safe, organized, and effective. Controlled medications such as benzodiazepines, opioids, stimulants, and steroids are closely monitored due to their potential for abuse and can only be obtained with a prescription. Handling controlled medication requires 2 people. Preferably school health staff to count and document the medication no less than weekly upon receipt and with each dose. At my school, we count daily with 2 nurses verifying the count every Friday. These medications must be double locked for security and disposal should be witnessed and documented. Students should not self-carry controlled medication to ensure proper oversight and safety. Next slide, please.
Okay, we have some reflection learning for you. So after hearing all of those tips and really guidelines that are coming from the state that Rebecca just gave to us, have you ever experienced a medication error as a school nurse? And if yes, why? So you can consider your answers. Did it happen because you gave the medication to the wrong student? Did you give the wrong medication? Did you give the wrong dose? Did you give it by the wrong route? Or did you give it at the wrong time? And if you did have an error, how did you feel? What was the consequence? And what did you do to prevent it again from occurring? So just consider that because reflection is a great learning tool. And we're going to move on to the next part of our presentation. Medication administration safety processes. General information on administering medication includes not having the first dose of a new medication at school. The time needed to monitor for side effects and adverse reactions is not conducive to the role of the school nurse. The school nurse should also take the time to educate the student on the medication. And this can be as simple as talking to an elementary student that this medication will help your stomach ache, or asking the older student if they know why they are taking the medication and then informing them on the predicted outcome. Always be sure that you provide medication in a quiet area to minimize distractions and provide privacy. And side effects should be documented and relayed to the parent and the prescriber. So these are the 6 rights of medication. For every dose of medication, every time a medication is given to a student, the school nurse needs to follow the 6 rights of medication administration to decrease medication errors. Those are the right student, the right medication, the right dose, the right route, the right time, and the right documentation. And we're going to go over each one of these a little more in depth. So when we say the right student, you would never pre-prep medication that you will give or you would expect someone else to give. Also, you need to identify the student by 2 different ways. Name verification. You want to ask the student, what is your name? Not, oh, are you Sam Jones? You want to ask them what is their name. And you also need to identify them by photo identification. Some school districts, insurance companies may require a photo to be on the hard copy of the medication administration record, on the prescription bottle or packaging, and on the medication drawer. So check with your district if they require that for insurance. Moving on to number 2, we're talking now the right medication. You always want to compare the new prescription order to the delivered medication and verify that that medication is appropriate for the student and prescribed for the appropriate purpose. You want to double check the medication against the order twice. All meds need to be received in their original containers, as Rebecca said, with original labels and stored per the manufacturer's directions, and you note the expiration date. And verify that the student is not allergic to the prescribed medication against their known drug allergies. 3 is the right dose. When you are transcribing the dose to the medication administration record or MAR, and it may be even electronic medication record, use leading zeros before a decimal amount that is less than 1 as shown on the screen, and do not use trailing zeros after a decimal. This helps prevent errors. Metric units should always be used when available. And you can see the link on the screen there in purple. That's for the Institute for Safe Medicine Practices list of error-prone abbreviations, symbols, and dose designations for more information on making sure you are transcribing right dose. Staying with right dose, before administering the medication for the first time, you want to record the student's weight in kilograms. You actually want to weigh that student and do not take the weight of what the parent has told you or what the student has told you verbally. You want to calculate the safe dose range using a PDR for the recommended dose over 24 hours based on the obtained weight that you just got. And if the dose exceeds the safe range, then you need to contact the pharmacy, notify the parents and the prescriber. And third, on right dose, you always want to double check the dose to be administered again against that medication order, the original medication order, and you do it twice. Calculate the amount of medication for the correct dose, clarify the dose in milliliters if the prescriber used teaspoons or tablespoons, and if the dose changes, you need to request a new label from the pharmacy. Remember, a licensed prescriber may change the dose only. A parent may not change a prescribed dose of medication unless they are an approved Pennsylvania licensed prescriber. Moving on to 4 is the right route. Always review for the correct route. See again for the Institute for Safe Medicine Practices, that list of frequent errors in the purple that was on the other slide. for more information on being sure that you are using the right route. And number 5 is the right time. You want to review the orders for the times of administration. If the medication is needed every 4 hours or more often, it may be given 30 minutes before or 30 minutes after the scheduled time. However, these are parameters and guidelines only, and they do not replace your nursing judgment. Students who do not show for medication should be located, and those who do not consistently show, you need to put a plan in place, a reminder plan. So that may be something with having them wear a watch alarm, doing a quick 1-ring phone call into the classroom, having it written into an IHP plan, or even into their 504. If a student refuses medication, they should never be physically forced to take it. And remember, a missed dose of medication is considered a medication error, and documentation as a medication variance should occur. This slide here shows number 6, right documentation. The types of medication administration documentation that should be placed in the school setting are listed. The PA Department of Health guidelines indicates that reports on the effects of medications administered should happen periodically, be it monthly or every semester. And this report process should be a part of your district's medication policy. And this slide explains the who, what, where, when, why, and how of what should be documented. Medication error documentation is also required. School district policy should include medication error reporting processes and standard forms. Medication return also requires documentation. Discontinued or expired medication should be returned to the parent immediately, and all unused medication returned at the end of the school year. Documentation for disposition should be noted, and signatures of the parent and the school health professional need to be obtained. If the parent fails to come and retrieve the medication, the licensed personnel and one witness should dispose of the medication and document the disposal. When disposing of medication that has not been picked up, do not flush it or dump it down the drain. You may dispose it in a trash can with an undesirable substance. If possible, use medication take-back opportunities in your community, and always be sure to remove any personal information on the medication before disposing. Standardization and systematic review. District-wide standard forms should be used for medication administration and processes, and this includes reporting error processes. A systematic review of medication processes in your district should be reviewed yearly, and policies need to be reviewed every 2 years. This increases a culture of being safe, and it also decreases the stigmas of medication errors. Should a medication error be made, you need to consider that that nurse is now the second victim and the student was the first victim. There needs to be support for that nurse and education on how to prevent it from happening again, presented in a manner that does not fear or present shame. If a sentinel event occurs, and a sentinel event is when there's harm or death due to a medication error, you need to follow your reporting per the state. However, I wanted to note that there is no indication of how this would be done in the PA Department of Health 2010 guidelines. Medication reconciliation is a process to ensure the safe and effective use of medications. Accurate and complete lists of all medications a student is taking, either they're taking at home, at school, but both should be created as a list and then confirmed with the parents and preferably the prescribers. This list should be reviewed with the transition of care, when new meds are written, or when new orders or when orders are rewritten. Though honestly, this seems very impossible for the school nurse to do for all the students you have on medication. NASN does believe that a good faith effort to collect this information meets the intent of medication reconciliation. So at this point, we're going to go and review a medication case study that Rebecca is going to present to you. So I'm going to let Rebecca take it away.
Okay. Everyone, please take 30 to 60 seconds to read this case study, and then we're going to pick it through. We're going to go through it. All right. Next slide. Okay, so let's break down this case study to see what went wrong and how we can learn from it. Laura, who is the full-time CSN, is out sick, and substitute nurse Jody administered the medication to 4-year-old Daniel. Daniel needs his daily dose of methylphenidate, but Jody mistakenly gives him Vistarol. This is a medication that he only takes as needed. Daniel notices the pill looks different, but takes it anyway when Jody shows him the bottle with his name. The next day, Daniel's mother calls Laura, concerned about his lethargy. Laura confirms the methylphenidate count is correct, but finds no explanation for the side effects. After investigating, it is revealed that Laura had been closely monitoring the methylphenidate, but not the Vistarol, which was less closely tracked. Key takeaways: you need to double check all medications, especially when multiple per student medications are involved. We need to track and count all medications, not just those that are running low. Communication is critical. Assumptions and lack of questioning can lead to serious errors. This case emphasizes the need for attention to detail, strict medication protocols, and clear communication to ensure student safety. Next slide. Today's scenario also focuses on coverage when the school nurse is out. Actually, you can do next slide, Jackie.
Okay.
Okay. When Laura, the full-time CSN, is out sick, Jody, a district-approved RN, fills in. While Jody's substitution is allowed, it's crucial to ensure continuity of care and student safety. The key considerations to this case study is, was Jody oriented to the health office operation, including the EMR system and student files? Did Laura prepare a substitute nurse folder with key policies, procedures, and emergency protocols? Providing a folder and quick orientation are essential steps to ensuring the substitute nurse is set up for success and students to stay safe. Next slide. Moving on. Daniel, our 7-year-old, arrives for his noon dose of methylphenidate. Jody, the sub-nurse, checks the EMR orders, but did she verify the hard copies too? She should have reviewed the substitute folder before the students arrived. Major concern: the medication cabinets were left unsecured on the desk. Big takeaway here: substitute need proper orientation, no guessing. Medication security must be locked down. No prep, no security, we've got a big risk here. Next slide, please. So the big mistake here is that Jody grabs a bottle with Daniel's name. She gives him the pill, even though Daniel tells her it looks different. Instead of stopping, Jody points to the label with his name and moves on. Reality check here. She gave him the wrong med, Vistarol, not methylphenidate. The correct medication was on a different shelf. Jody didn't look carefully. The two major failures here is Jody didn't listen to the student and Jody didn't follow the 6 right of medication administration. This wasn't just a small error. It's exactly how medication mistakes happen. No shortcuts. Always double check and always trust the process. Next slide. We can break this down now. So Jody misses several critical steps. First, right student. She did not verify the student using 2 methods. Always ask their name, use a photo ID. If the EMR includes a student photo, use it. Even better, include photos on medication bottles, orders, and drawers. Some districts even require this as their liability. Second, the right medication. Jody didn't double check the medication against the prescriber's orders. Always verify it twice. Labeled order every time. Third, the right dose. She didn't confirm the dose. Checking the documentation and verifying it twice before administering the medication would have shown her that the hydroxine and the methylphenidate were two different dosages, leading her to knowing that there would have been a problem. Fourth, right time. She didn't verify the timing. Review exactly when the medication is scheduled, not that this is just close enough. The bottom line here, the 6 rights are not a suggestion. They are non-negotiable standard nursing practice. Next slide, please. Now the consequences start rolling in. After school, Daniel's feeling very lethargic. He tells his mom that a new nurse gave him a pill that looked differently. This is a big red flag. The next morning, his mom calls Nurse Laura, furious, demanding answers, and rightfully so. Let's talk about what could happen here. Injury. Daniel could have suffered serious health effects. Adverse reaction. He took a medication not intended for daily use. Overdose. What if he had a sensitivity? What if the dosages clashed? What if he already had taken the hydroxine before coming to school? Legal action. The family could sue the district, the nurses, the school, anyone tied to the mistake. The key takeaway here is one medication error just doesn't end at the nurse's office. It follows the student, it follows the family, and it follows our entire school system. Mistakes like this have really real-world consequences. One misstep at noon turned into a full-blown crisis by morning, and it could have been 100% preventable. Next slide, please. All right, let's get to the missing dose. Laura counts the methylphenidate pills, and everything matches up, which confirms that a dose was removed yesterday, but here's the problem. Daniel didn't get it. So where is this missing dose? Let's run through the possibilities. Scenario 1, Jody took the pill herself. Scenario 2, Jody gave the medication to another student who wasn't Daniel. Scenario 3, Jody realized her error, panicked, discarded the pill to keep the count looking correct. Scenario 4, the cabinet wasn't locked properly and someone, staff or student, took the medication. Here's the hard truth. The keys to the medication cabinet weren't secured, and Jody didn't double check it like she should have. Even if the medication cabinet was locked, there's still a risk. Overnight or after school staff could have gotten access to the keys because they're left out on Laura's desk. The big takeaway here, medication security isn't best practice, it's our only practice. Next slide, please. Now things are getting real for Jody and Laura. Laura calls Jody and Jody denies giving the wrong medication, but the facts are just not lining up. The student's report and his behavior, it's just not adding up. Laura does the right thing. First, she speaks to Jody, and that's necessary. But given the conflicting details, the next step is clear. She needs to report the issue to the Director of Student Services. And here's why. The medication errors must always be taken seriously and immediately. Per district policy, a medication error report needs to be filed. Administration needs to be notified to ensure transparency and proper follow-up. The key takeaway here is you cannot fix a mistake that you don't acknowledge. Accountability starts with reporting. Next slide, please. So let's break this down. Laura did most things right, but there is a crucial slip up. When Laura received the methylphenidate, she followed the policy to the letter. She counted the pills carefully with the parent. She signed off and did everything according to best practice. She followed the correct protocol. This is why this should always happen with controlled medication. But here's the issue. With the Visceral, Laura dropped the ball. Because the bottle had so many pills, enough for months, she didn't do a count. She accepted more than a 30-day supply without following the proper sign-off and count process. She failed to document and receive the medication properly. The big takeaway here, consistency is key. Following the policy once isn't enough. It has to be done every time for student medication, no matter how big or how small the bottle is. Failing to document is a risk waiting to happen. So let's consider this now. It's time to reflect. What steps need to be taken to fix the situation? First, we need to review the process for medication administration and security. Immediate actions, which must include reporting the medication error, retraining staff, and updating security policies. The Director of Student Services is responsible for following up with the team and ensuring all reporting is done. Laura must take responsibility for the failure in documentation, and Jody needs a clear understanding of her responsibilities regarding medication verification. This applies to all substitute nurses. To prevent this from happening again, we should strengthen training for substitute, ensure clear medication protocols, and establish a double check system for all medications. Additionally, securing keys and cabinets and making sure documentation is part of the process every single time is crucial. The takeaway here is that it's not just about fixing one mistake, it's about creating a system that prevents these errors from happening like this in the first place.
So in conclusion, let's look at these core actions. And this is your game plan for safe medication administration. You want to be sure that you follow the Pennsylvania Nurse Practice Act and all Pennsylvania laws and acts every single time. You want to use the NASN medication CPG and toolkit and the PA Department of Health guidelines. These aren't just guidelines, they're evidence-based best practices that keep you and your students safe. And you want to be sure that your district medication policies align with these documents. It has to be consistent and compliant across the board. You need to be sure you always follow the 6 rights of medication administration. And I'll say it again, every single time. Do not skip a step. And be sure that you secure the medication. It has to be locked down because it can be a risk. And always apply the principle of quality improvement. Medication reconciliation and systematic review are your tools to minimize medication errors in your schools. And remember, it's not just about following rules, it's about creating a culture of safety where the system supports your health office so you can support the students. So Rebecca and I would like to thank you for having us tonight. If you would have any questions or concerns, we are welcome to answering those. On the screen is our emails, so you could email me or Rebecca or both of us. We're very happy to answer your questions. We enjoy doing this, and we hope that you've learned from it because it is a very big responsibility of the school nurse. Just to let you know, the references are all listed here, including the NASN references if you wanted to look for your clinical practice guidelines and the toolkit. So thank you all very much for having us, and we appreciate you, and keep doing what you're doing because you make a real difference every day in the lives of your students. Have a great evening.
Have a good night, everyone.